everyone. We're very excited that you're here. I'm Mahalit, and I am part of a consulting team here. With me, Hubert is one of them, Sandrine, Kira, and Shuri. We are a consulting firm, a consulting group for PharmAccess, which has Mr. Sister Clinic as one of their programs. So Mr. Sister Clinic does an exciting work in Namibia, in rural parts of Namibia, using these wonderful trucks that you see here. So if you remember, they're just like ice cream trucks from when you were kids, and if you remember how eager you were when ice cream trucks came, that's how eager rural people in Namibia are to get services from Mr. Sister. So Mr. Sister is a mobile clinic in Namibia under PharmAccess, and we, as a consulting firm, were asked to do a quality improvement process for patient rights. Patient rights, patient rights include the right to privacy, the right to privacy of information, the right to informed consent, the right to get treatment without discrimination, and all of these we've addressed in our deliverables. So, Joint Commission International, along with COSASA and PharmAccess, came up with safe care standards. Safe care standards are there to ensure that quality of services provided by primary healthcare providers is efficient and up to date with the standards that they've come up with. So, as part of this, safe care has very stringent and very strict rules and standards that healthcare providers have to live up to be accredited. And part of this accreditation is done by JCI and COSASA. And Mr. Sister Clinic, as a primary health provider, was assessed in September. And one of the shortcomings that SafeCare has found as part of the accreditation process was lack of quality improvement process within Mr. Sister Clinic. So as a consulting firm for PharmAccess, we were contacted, and our scope of work included the access, a method or a system to assess the current situation, a report and a mechanism by which Mr. Sister can report quality challenges on patient rights, and finally a system by which they can consult and propose solutions to policies and procedures. So what we've done is we went through these steps ourselves first and made recommendations for Mr. Sister in the process. And Hubert will now take over and explain in detail what we've done. So.
Thank you, Mahi. This is where the process that we are trying to look at. And now I'm going to present our methodology and how we have come up with the recommendation. Okay, thank you. For the first scope of work to assessing the current situation, we have come up to find that doing that we did a process map. And by the process map, we are trying to find what are the problems on the ground. As you can see, these are the trucks that come in the mobile clinics, and they park there and the patients are queuing. And we are trying to see where could we find the gap in the process of improving their quality improvement. We have identified the three areas. The first is the entry point where the patients are queuing. We have found that there is lacking of access to information because the patient don't have information regarding their rights. The second area were about the consultation. In order to fulfill the patient right, we have found that the clinician don't have sufficient tools to help them identifying that this is a patient that needs informed consent, or just he or she needs to know their right before being consulted. Another gap we have found on the patient at the end point, because we have found that the Mr. Sister Clinic doesn't have the tools to monitor the progress, how the patients are being satisfied by their services. So as I said, these were what we reported to the Mr. Sister Clinic. Lack of access for the patient to get information, the clinicians lacking tools to help them satisfy the patient's right, and the Mr. Sister doesn't have like tools to monitor the quality improvement. After that, we identify the gaps. We now coming to what should be our consulting process. What are we recommending for the Mr. Sister? We provided 3 tools, instruments for each gap that we identified. For the information access, we designed the brochure that will help the patient, to get aware of the information, their rights, as you have them there, given under. And also, we recommend the Mr. Sister Clinic to have a patient rights acknowledgement form, that to have the patient that now he or she is aware of their rights, and before entering the seeking care, they can have all the information provided and know exactly what they are going to go through. On the second step, on where the clinician needs to have the tools to help the patient identify their right to fulfilling their obligation, we have come up with the standard operating procedures to help the clinician to know the process in case the patient needs an informed consent, because we have found that there are some of the services that are providing that need an informed consent. So this is the SOP we are providing, and in our final report we have a flow chart detailing from which step to which step the patient should be treated, where they should just get informed consent, what should the clinician ask. All those steps are detailed in our flow chart. The last tool we provided were the monitoring tools. And these are monitoring tools was kind of to respond to the gap that we found at the end, that the Mr. Sister Clinic doesn't know that the patient is satisfied by their services. And these are the monitoring tools, and they have hand out the patient feedback form that the patient that could fill after they get care, and all the tools that will be compiled, compare that, and get to the head office, so that the head office can track how the services are being provided and how the quality improvement process is being done. So this will be done quarterly, and that patient feedback complaint form will be on a daily basis. So to conclude, that are how our scope of work were done, and that were the deliverables, and what were our recommendation. I thank you very much for your attention, and I welcome your question. Thank you.
Questions?
I have a question. Can you guys go back to your process map?
Don't look if you get dizzy.
So is there ever a circumstance where after the nurse treats the patient, that instead of, if the patient needs follow-up, instead of referring to a follow-up appointment in the clinic, could the nurse ever refer to a public state hospital for follow-up? So am I not following the train there, or is there an arrow missing?
So if the patient is not treatable at the clinic, the nurse refers the patient to the public state
So say
hospital.
the patient is treated for some component of their treatment at the clinic, but they need a follow-up appointment. Is it ever a situation where then they would go on to the public state hospital, or would they always have their follow-up appointment at the same clinic? Do you see what I mean? Like for any tertiary care or any other services?
No. That's a very good question. That's a very good question. So, while we were going through the process and how the whole, situation works, I have to say that we did come into that. We didn't run into that situation, but what was pointed out was the van goes back to the same location either twice a month or once a month. So. That's a very good question to find out, and including here. However, they will be coming back to be followed up on.
Okay.
Is the information that
So, I have let me go back and sit down. I have a question. You have a process whereby you've identified possible areas of problems and you're trying to address the different areas. Where was the continuous quality improvement element in this? I'm struggling to see it, but I may have slept through it.
I think that's detailed further in our report. So the last tool that we presented was the monitoring tool, and so that would be something that they could use. And we've advised them to use on a quarterly basis, and so that they'll collect that data and kind of reflect and see how they're progressing. And in addition, then we also have the feedback form, which Sandrine can elaborate on, which we'll also be collecting data from. So it will be used continuously, and I think in our report it details more how often they should use it and how they can continue the process.
Okay.
And that monitoring tool is based off of the Safe Care accreditation criteria, so specifically so that they can meet that criteria or to see their progress in meeting it.
Right. But I just wondered if you had sort of documented you've got a way in which they know what the criteria are that they've got to meet, and that they can measure where they are, but have you described for them a process whereby they can go from, well, we've got this data and we want to be here, how are we going to go from here to there?
So we have a future process map that is included in the report, and that is the process of, if you went back to we don't have it in here, but it's in the report. But when you come, so while the patients are waiting, then you could, using the tools, it includes using the tools to inform them of their rights. And then when it comes here, it describes, an SOP of how the nurses are going to get consent from the patients. And it also goes ahead to, it has another piece over there. So it kind of covers where the bust bubbles are, and kind of including those tools in there in terms of documentation.
All right. Thank you.
In your patient's feedback form, the access to information question, there is a question that asks the first question actually, do you know the name of the nurse who provided care to you? So my question is, by asking this question, are you trying to assess whether the nurse introduced himself or herself to the patient, or the patient knows that nurse out of the clinic visit?
Oh no, we're trying to see if the providers, so the nurses, introduce themselves to the patients.
That's an actual patient right that's outlined in the charter. That the patients have a right of knowing who their provider, the identity of their healthcare provider.
Did you consider phrasing the question into specifically what you want to know, like did the provider or the nurse introduce himself or herself? What were the pros and cons of using that question instead of this?
And
if you did.
Probably what I can add on that is that in normal medical practice, it's good to have identification, like a name tag or something, so that it's easier just to identify to a patient before we try to treat him or her. So in that way, we wanted to know if the patient is aware of someone who have treated him, and just also to go back and check in case we need to give a kind of feedback to specific person. So it's good to have like an overall feedback, a general feedback about how the staff are providing the care, but if we could also know specifically some people that we can try to train or just to improve how they are providing the services. So I think that's in that way.
What made you guys decide to do yes or no scales as opposed to Likert scales? Because with the Likert scale, you might get, more variation in your answers as opposed to what if a patient doesn't have maybe they're more in between, to a question like were your needs met, or what is your health education provided meet you? Did the health education provide meet your needs?
I think it's kind of questionable, I can answer this further, sorry, I just jumped in, but it's questionable the literacy rate of the population that they're serving. So our aim was to make this as simple as possible, because some of this might have to be done, over the phone or in person versus actually so for to be understood by the patients.
Yeah, that was the, we had a debate over that. Should we include more options? And we were, as Kira said, we were looking for something really simple to use both for the patient and for the person administering it. And if we were doing a more detailed, having more detailed answers, it will be meaning also having a more detailed analysis tool. And we're like for the immediate implementation, we're looking for something really simple, and maybe forward we can expand on it. Because the questions also that are were you treated with respect and courtesy, and we have the blanks so that if the person said no, they can expand on it. But we didn't want people to just. We were feeling like it should be straightforward. Did you feel like you were treated with respect? Yes or no? That's really what we were trying to.
Okay, thank you.